Okay, well, I really want to be respectful of everybody's time. We have an hour on the schedule together today for our first session of our Meaningful Change series. So, welcome to our first Meaningful Change session of 2026. I'm Danielle Hayward. I am the Interim Executive Director of the Cute Syndrome Foundation, and I'm so excited to have all of you with us today. Our Meaningful Change series typically focuses on topics that impact quality of life for members of our SCNA community. There's currently lots of advancements and transitions happening in the community. We're now over 650 families strong in 60 countries. We're seeing some exciting new developments in research and treatment, and I'm here welcoming you instead of Kacie. So we thought this might be a good opportunity to get the community together and talk through some of these recent developments. I also want to take a moment today to reintroduce the community to some of the programs and resources that we have as a foundation. We always like to remind everyone that the Cute Syndrome Foundation is by families for families, and we are here to support you along every step of the journey. And we have plenty of ways currently to help support you on your journey. And we also always welcome feedback if you have an idea or something that you think would be a benefit. We'd love to hear that. So we're going to kick things off with our founder and board president, Hilary Savoie, to talk a little bit about the history of the foundation and our recent leadership transition, with the hopes of kind of talking about where we've came from before we talk about where we're going. Hilary, thank you so much for being with us today.
Oh, I'm so excited to be here. I was having just a moment of it's been a long time since I've been on Meaningful Change, and I was having a moment of when we started these and thinking about how what an exciting and novel idea it was at the time, at the height of COVID, for us to start holding these meetings all together to talk about what was happening in the community. So it was a really nice nostalgic moment for me as I was awaiting to come on here. So thank you so much for having me. Um, so I think the place to start is just, at the beginning. And folks, if you guys want to come on screen, I love to see everyone's faces, so please don't be shy. Um, so the Cute Syndrome Foundation started a long time ago. Thank you, Nicole. A long time ago, with my daughter in mind. My daughter Esme had a VUS and SCN 8A, and we believed it to be pathogenic because many people have VUSs, and we figured it was pathogenic, and we put the full force of the Cute Syndrome Foundation behind working on SCN 8A for my daughter Esme. She's now 15, and the funny joke on me was that Esme doesn't in fact have SCN8A. Her variant of uncertain significance was later reclassified as likely benign. But in the time that we had connected with the community, like many of you have done, where you get that genetic test, you're told don't bother Googling it, and you Google it, and lo and behold, there's maybe a little, at the time, there's a family group of, I think maybe 30 families at that point. Karen was there. Um, and I found this community and I fell in love with this community. And I saw all of the children in this community and they reminded me of my daughter. And so while she was being undiagnosed, um, there was a child in the community who died. And that child's name was Easton. And after that happened, despite knowing that Esme didn't fully fit here, I decided that there was no way that this foundation wasn't going to stay with this community and stay focused on this community because we owed it to Easton and to all of the kids who would come afterwards. So from about 2015 until 2021, I ran the Cute Syndrome Foundation, and the goal was at first to just fund a small amount of research. $25,000 was the goal. And lo and behold, here we are now you know, with staff and a big group of volunteers and a wonderful legacy. I am so proud of the work that's been done here by this organization. And, I think it's really important to also just recognize that this organization is, well, my daughter was sort of the impetus for it. It never was about her or just her. It was always about what could that spark from this extraordinary young woman, what that could start and what that could mean for more people. Um, so I'm happy to take any and all questions about the foundation, where we came from. Um, but that's sort of, I guess, the way that I like to talk about it, and also just, it was a real pleasure for me to be able to hand the foundation off to Kacie, and have it have new life and new inspiration with a new leader, obviously while still staying connected and via the board. And now it's another really extraordinarily pleasant moment to see Danielle stepping into this role and recognizing that each leader is going to have an impact on how the foundation moves into its next chapter. So I guess I'll leave it with that. Danielle, did I cover everything that you wanted me to cover, or do you have any pointed questions you'd like to ask me so that I cover
Yeah,
cover
well,
better?
first, just building on what Hillary said that she wanted to raise $25,000. I do want to point out $25,000 at this point. We have granted over $500,000 towards SCNA research, which is absolutely incredible. So that is over what is going to be 13 years in May, which is incredibly exciting. So it certainly surpassed everything that you initially imagined in the beginning, and so much of that is thanks to your hard work in getting this foundation off the ground. The next thing I want to ask you is the $1 million question that we get all the time. Why are we called the Cute Syndrome Foundation?
Oh yeah. Okay. Well, yes, it is $1 million question. So my daughter Esme, who I wish I had her right here and I could pop her up on the screen with us. I can probably grab a picture in a second. But when she was tiny and before we had our misdiagnosis, we still don't have a diagnosis. People would ask me what was wrong with her. And I hated that question because I felt like I just sort of couldn't imagine what it would be like to go through your entire life and have people have that be a question that they asked about you. And so, like many things with Esme, I decided to sort of turn it on its head. And um, I had had a friend who had mentioned to me early on when I said, well, the doctors are saying she has a syndrome of some sort. She said, of course she has a syndrome. She has the cute syndrome. Look at her. She's so cute. And so that started to be the way that I answered that question. Um, Nothing's wrong with her. She's got the cute syndrome. What's wrong with you? Um, and that then turned into a blog that was called The Cute Syndrome. And I had a decent following for a while there, and that was kind of the lever that shifted eventually into the foundation. And so it carried that name in honor of Esme. So I guess while Esme doesn't have SCNA Day, and while in retrospect I might have named it something different, because it does cause confusion on occasion, I do love that it kind of carries her. Technically, there's only one person with the with the actual cute syndrome, and it's Esme. But that's okay. She can share that name with everyone. Um, and I think it's also maybe important to that $25,000, $500,000 question, um, that the vast majority of the foundation that built this foundation was just right there in my living room, playing on the floor with my child who couldn't really sit up or crawl at the time, and just between therapies and whatever, putting cute pictures of her on the internet and then growing from there. Um, So I think it's something I want families to remember when they think about and see something that's really well established here, is that it was built, it's not, it was built out of a life that looked like everyone here's life. Um, and we're all capable of doing pretty extraordinary things in the moments between caring for our kids because they need it from us. So,
Well, thank you for sharing that, Hillary. I think it's always nice for people who are new to the community to hear that story directly from you. It's really special. So the next thing that I wanted to take some time to talk about is our recent FDA patient-led listening session. This was a really exciting milestone for not just the Acute Syndrome Foundation, but for the SCN8A community as a whole, that we had the opportunity to talk directly with the US Food and Drug Administration about SCN8A. And so I want to bring our immediate past executive director, Kacie Craig, who is now our volunteer family programming advisor, into the conversation. The FDA patient-led listening session was really a labor of love for Kacie, and I'd love to kind of hear more about what that is and what impacts that could bring to our community.
Yeah, sure. Sounds good. Thanks, Danielle. And Hillary, feel free to jump in at any point in time
Yes.
during this conversation as
I
well.
was
But
also going to say too, we have Mary Ann Sutcliffe, who's
mhm,
the secretary of our board of directors on the call. And we also have Shelley Frappier, who's our director of patient engagement and data management on the call. Both of them were extremely instrumental in making this happen. So we'd love to have input from both of you as well if there's a point where you need to chime in.
perfect. Yeah, I think, one thing that Hillary really started the foundation with was storytelling, right? And so it was this huge like we wanted people to really understand our lives and all aspects of the life of, we definitely have challenges, but we also have these moments of joy with our kids. And so when we started looking at an FDA patient listening session, we had to figure out what is this and how do we go about it. And so I remember having a conversation actually with Shelley, and we talked to someone with the Reagan Udall Foundation and was like, okay, we think we want to do this. What is this? And how do we go about it? So essentially, it's an informal meeting with the FDA. You have about 90 minutes. It is an application process. So you have to fill out an application, and then the FDA sends it out and says, okay, is anyone interested in hearing about this group? And have we heard from this group before? And so it is kind of a once in a lifetime thing to where once you have this opportunity, it's not like you can do this every year. And so we said, okay, we're going to do this. And so we filled out the application. And this whole process took, gosh, at least it was a little over a year by the time we started thinking about it and it came to fruition. And so we had 90 minutes that we got to essentially have the ear of FDA, which was so important for our community because we want them to understand not only the data, but how to humanize that data that they see come across, their desks. And so when they hear maybe about a potential treatment or about SCNA, we want them to really see our community and see our families for who they are, the joy, but also those really difficult times that we go through as well. So we get to talk to them directly. It gives the smaller communities a voice, but like I said, it really humanizes that data. But it also helps them define or us to define and for them to hear us what success looks like for our community. Because with our community, that might look much different from another community. So, for example, if we're talking about maybe seizure success, another community say, we want complete seizure freedom, and that is our benchmark. That's what success looks like. But for our community, it might be you know what, if I can get 10% seizure control, like that is meaningful for us. So one of the big things that we wanted to make sure with the FDA patient listening session is that there's such a spectrum of SCNAA, right? There are so many different families and we all look different. And so it was like, man, how do we put all of those life experiences, all those the impact on our patients, our kids, the siblings, the caregivers, how do we put that essentially in 60 minutes? Because you have to have enough time for FDA Q&A session, things like that. And so we kind of took a unique approach. We went at it we used sponsorship funds to be able to pay for a videographer to go to 5 families, and we had them interview in their homes. And so we took an hour-long interview essentially for each one, and we put it down to about 10 minutes. And so we had 5 major stories that we highlighted. So we have Margot's story, which was on the severe DEE side with Madeline and Odin and Chris Burge. We had Will's story, which was Lost to Suit Up, which was Liz and Michael Ramirez. We had Megan's story, which was an adult patient perspective. So Megan and Trish Rathke. We had Lucy's story, which was a loss to severe DEE with Danielle and Phil Hayward. And we also had Max's story, lost to severe DEE with Dianelli Cabrera. And so we had those stories that were highlighted, but that really wasn't enough for us. We were like, we want to be able to highlight more than what actually FDA is typically only hearing 5 to 6 stories. And so we also utilize the Orlando caregiver interviews that we had recorded from 2023. And so we were able to do a caregiver perspective montage video, and it was about 5 or 6 minutes. We were able to highlight Krista and Sean Smith. We were able to highlight Nora Lyons, Sandy and Brian Bush, Megan Gard, and then also a few insights from Hillary and myself. And that really kind of hit home on what it's like as a caregiver. But also it talked about, our lovely children and some of our fears of what, life with SCNA looks like. But that wasn't enough either. We wanted more. And so we wanted to really show FDA that this is that all of this goes beyond seizures, right? Like are a huge impact for a lot of our community, but it wasn't just about the seizures. It was also about these beyond seizure impacts. So, for example, behavior challenges, sleep challenges, the financial, mental, and physical toll on caregivers, siblings. So there was a lot of other stuff there that we wanted to be able to highlight for them. And so this is when you guys may remember Shelley did a call out for patient interviews or caregiver interviews, and she made pretty much almost like an hour-long interview with 13 caregivers that signed up with her. And she asked them a whole long list of questions. Then she combined all of that information, compiled it into a report. And we presented that report as a pre-read material for FDA. And then she gave a quick highlight of what that report was showing. And then we took a clip of Katie Banks and her daughter Averly from the 2025 gathering, where she really talked very vulnerably and very beautifully about her journey with her warrior Wyatt. And so we showed that, and it really, showed the behavior challenges and the constant supervision that a lot of our kids require. So with all of that, with the videos, with the interviews, with the speakers, we were able to highlight 25 families that have, that SENA has touched their lives. And I'm really happy that we were able to do that and on such a large scale, because each one of you are so incredibly important, and your journey is so incredibly important. And I just want to take a moment and say, thank you for all of you that either participated in an interview or in the caregiver, interview that Shelley did. It was really, really important. So I'll kind of, stop there and talk a little bit about like what happens now, right? Um, so another reason why we wanted to record our family stories, so we essentially had the intro and we hit play, and for 63 minutes are all the patient stories. And one of the reasons why we did that instead of doing it live was when we had those videos and we were able to email that out and it was attached to FDA's invites to our patient listening session, it now lives in their email. So at any point in time, if they're like, hey, you know what, I remember hearing something about SCNA, and now maybe this future treatment's coming across my desk, and we want to see, is this, relevant to the community? They can go back to their email, they can click on those videos and be like, oh yes, okay, I do remember this.
And Kacie,
So
how does
once,
that
yeah.
differ from what they typically experience?
Yeah. So a lot of kind of traditional patient listening sessions, they have, 5, 6 families come on and they have a certain allotted time and the family talks live. And those meetings are closed meetings. They are not recorded. So essentially everything that is said and presented in those patient listening sessions, you're unable to share those. They cannot be recorded because they're a closed meeting. So with us being able to record kind of the meat of our patient listening session, then we're able to share that in, on our side, versus just, having the live sessions and then, not being able to share anything besides a summary report afterwards. Yeah, that's a good
So,
question.
regarding the videos that we recorded, we do have a question from the chat that says,
Yeah.
are those patient stories shared with the community? So, I think our plan was that once we have our finalized notes, and if you want to talk about that process a little bit too,
Yeah.
we will share both the notes as well as the patient stories with the community.
Right, right. So we're working on, and I say we're lightly, Marianne is working on a summary from our meeting. And so essentially this is going to be a report that we will house on our website. It will also be turned into FDA so they can house it on their website. And it is essentially going to capture what our meeting was about. And so once we get that done, we kind of wanted to wrap it up in a nice bow for the community, have the summary report, have the patient stories, essentially everything that we provided to FDA, besides the actual meeting, since we couldn't record that, and share that with our families, to be able to, put it on our website and things like that. So it lives there. Yeah.
Perfect.
Yeah. Anything else that you can think of, Hillary? I mean, as far as what the FDA, how they use this information on their side, one of the things I think about is like weighs risks and benefits, and I think that could be important for our community. Help guide decisions and things like that. Can you think of anything else that you think is important for us to highlight for the community?
Yeah, so I think what Kacie sort of highlighted is that we figured out a way to present a diversity of experiences, right? And which is so important in a community like ours, where we know even from kids who have not dissimilar paths or prognoses or sort of experiences, they are so different. And so it's really hard to figure out how you in 60 minutes tell them all the things that you want them to know about the community so that they can imagine why for one patient seizure control may be really important, but for another patient it might look different, right? They might have other priorities. Um, so I think why that's important. So let's zoom out. I had the honor of closing the session and trying to figure out how in real time to summarize what we heard, and make sure that each of the things that we were hearing was actionable in some way for FDA. So we can tell them stories. As Kacie said, that is the sort of foundation of who we are as storytelling. But they can hear stories all day, and if we don't help them draw the links, to what actual clinical trial study designs might look like for this community, what might be meaningful change to the point of the name of this series, is actually very pointed, and maybe we can come right back to that because that might be helpful. But also to help them understand what some of the limitations of trial participation might look like for a community like this. It is really hard to design clinical trials for rare heterogeneous communities with really severely impacted children. It is really hard because the whole idea behind a clinical trial is that the data is as pristine as possible, that every patient is as similar as possible, because that helps them understand what the patient group can and should look like with and without treatment, and make an estimation of whether there's improvement. And if you're thinking about a hypertension drug or, a breathing medication, those things are easier to measure. When you're thinking about seizure count, in theory, it should be easy, but it's actually very, very difficult. And it's even much more difficult to then try to understand how that seizure impact, maybe a small change, could create a really big change in families. And that's where we get to the idea of meaningful change. Which is, FDA is tasked with understanding from the results of a clinical trial whether the data that come out of the trial, whether they constitute a good risk-benefit profile, and whether the change associated with that drug is meaningful or not. That's their whole job. And so there's two pieces to that, right? The first piece is risk benefit. And so it's really important when you talk to FDA, you have an opportunity to talk to them, to show them that we as a community are already dealing with a very intense risk benefit profile in our day-to-day lives. And that we as a community are willing to take certain risks associated with treatments that may yield really good results because our standard of treatment is not great. And then to the meaningful change piece, they may, there's a kind of a standard in the epilepsy world that it's like a 30 or 40% seizure reduction is meaningful. And so you have to train them to understand that in our community where kids may be on 4 medications and still seizing daily, that 10% difference is meaningful. Or that a change in seizure type might be meaningful. Or a change in seizures plus, like a minor change in seizures plus alertness might be meaningful. Your child, I have said a million times in all kinds of different settings, when Esme was seizing all the time, well, we can make her stop. We just put her in a coma. But that's not what I want for my child, right? I want her to be alert and happy. And so those are the things. It's not natural for the agency to necessarily understand how we think about this. And that's where we come in. That's where we come in to tell them how we think about it. And so the other part that I think is really important is that, again, they want as pristine data as they possibly can get. But we know patients in clinical trials in this population are going to wind up hospitalized. They're going to wind up needing to have medications changed when they're in the hospital. And that may have nothing to do with the clinical trial. That is just baseline experience. And those kinds of differences in the data are really difficult for an organization like FDA to know what to do with. And so that's also part of our role, is to say, okay, wait a minute, you need to understand the picture here. And it needs to come from us as a community and not the companies developing those drugs. So, and that's important for today, but it's also important for treatments that we expect to come down the line in the future. And we had done some groundwork with FDA around this. We did outreach a couple of years ago and had a 24 hours notice for a meeting with someone at FDA, and we shared collected responses from the community about risk benefit and meaningful change. So they have that in a dossier and they keep it and they reference it still. But this is a much more, it was a cool opportunity, but this was a much more robust and clear opportunity.
I might just add a couple of more things, just really briefly. Kacie mentioned that it was an informal meeting, and nothing with FDA is really informal. What she refers to when she says that is that it wasn't a regulatory meeting, right? It wasn't a meeting that was to approve a drug or something that was like legally binding to them. It was just a situation where they were listening to us and then they had an opportunity to ask us questions. So that's what FDA refers to as informal, because if you think about like the structure and the process and everything that went into making the meeting happen, there's nothing informal about that part of the process. So I just wanted to clarify that part with you. And then I think the term closed meeting was mentioned a couple of times on the call too. And what that really refers to is that it wasn't open to the public. So it's not like, the team could have said, hey, here's the link, everybody get on and listen to what's happening with FDA. What they define as a closed meeting is the speakers are on the call and a very short list of people that are there to respond to questions if questions come up that they might have. Or, for example, we had a couple representatives from the Epilepsy Foundation and the Rare Epilepsy Network, and just so that they also can hear what's going on with the FDA, so that FDA is not having to sort of repeat the conversation with the other organizations. So it's a very interesting process and very defined process. And at the end of the call, FDA had the opportunity to ask a few questions, and they did, and nothing unexpected. It kind of gets to the things that Hillary was talking about, like how is your community looking at these trials, and how can we make it easier for families to participate in these trials, and all of that will be summarized in the report. But just wanted to share just a little bit more information with you on the process itself.
Great points, Marianne. I'd also just throw in there too is one of the big things that we really hit with FDA is urgency, right? The urgency is absolutely real for our community. And it pains me to say that whenever we first started this journey, we were planning on highlighting two families that had lost their children to SE and AA. And by the time the meeting actually happened, we had four that had passed. And so it just really shows what our lives look like, what our fears are like, and it is the urgency is real for us and for our communities, and I feel like that was portrayed to the FDA well.
Absolutely. Thank you, Kacie. Hillary, anything else that you wanted to add about the patient-led listening session?
Um, No, I think it's important to, I guess it's easy now that I'm not part of the daily team to come in and praise everybody who worked on this, and what a great job they did. It is a huge amount of work, as Marianne said. There are formalities to how you engage the agency and a lot of rules. And it was a wonderful project for Kacie to kind of end her tenure with. But I think it's also important that there are less visible folks who also participated. Marianne obviously being one, and Shelley being another, and Danielle, as well as everybody else who shared their stories in whatever form they shared them. I think again, it can be hard to know why you share your story, what's it going to do, but this is the kind of thing that it does, right? It can move a mountain, especially when people trust us to sort of choreograph how it's presented and make sure that the takeaway is cleanly there. So even to Marianne's point, we choreographed how we answered the questions, like who goes and who speaks, so that we made the most use of our time with the agency, really carefully.
Thanks, Hillary. Yeah. One thing I do want to point out too is that this was a general meeting. So this meeting had nothing to do with any specific treatment pertaining to SCNA. This is really to give them an idea of our community's needs for things that they may be looking at now and things that they may be looking at 10 years from now. So this was really an opportunity to lay that groundwork, and it is not treatment specific. As Hillary and Kacie both alluded to, this is not something we do again. This is it. And I think we're grateful for all the families that spoke, and the information that we put forward was very, very valuable. So yeah. Well, thanks for talking about the patient-led listening session, guys. Does anyone else in the chat have questions about that topic specifically? And if not, we can always come back to them at the end. And of course, we are also always here to answer questions. You can always send us an email or send us a message on Facebook. And we will be sending out those notes and the link to the video that we produced as soon as everything's ready and available. So on the topic of research and treatment, I wanted to address a couple of recent headlines that have been floating around, shared around the SCN8A community, related to some research breakthroughs and some treatments that we have in the pipeline, and kind of just dissect what those headlines mean for the community going forward. So I am going to reshare my screen. Kacie, did I do it correctly? I'm going to let everyone in on a little secret. This is the very first time I've actually managed a Zoom webinar. So
You're doing great. You're doing great.
Okay. So these are the graphics that you may have seen floating around your social media feed. We've had a lot of families sharing them, and I kind of want to just break down what these news articles were about, why they're relevant, and why we may need to take a beat before celebrating too hard, right? So the first one is new approach could transform epilepsy treatment. And this came out of the University of Virginia. Many of you have had the opportunity to meet Dr. Manoj Patel or hear him speak at our annual gathering. Kaylee Reaver, who's also very involved in the development of this gene therapy treatment, spoke this past year in Atlanta at the annual gathering. I also want to say, if you're interested in the science of this, the Patel Lab published their research in February, and we can also make Kaylee's presentation from the gathering available if you'd like more information on the science of gene-based editing. But what I want to talk about is the content of the article. Basically, it summarizes that in this study, researchers used base editing in mice that carried an SCN8A mutation, and what they saw was pretty encouraging. So after correcting the mutation using base editing technology, seizures were dramatically reduced or even eliminated. They also saw improvements in survival, movement, and some behavioral measures. So that all sounds extremely exciting, and it is. But it's also important to keep advancements like that in perspective. So this study has only been completed in mice so far, and there are still a lot of unknowns. So we're still unsure when this may be able to be trialed in humans, and still very unsure of what results in humans might look like. So super important step forward with a brand new way of potentially addressing SCN8A at its cause rather than applying a medication. It's incredible progress from a research standpoint, but definitely cautious optimism, and this will be a process as we continue to move forward, and the Patel Lab continues to study this further. The other headline was Praxis Precision Medicines announces FDA acceptance and priority review of new drug application for relutrigine in patients with SCN2A and SCN8A DEEs. So this is related to the drug, the investigational drug by Praxis Precision Medicines, relutrigine, that many members of our SCN8A community participated in the clinical trial for over the last few years. So what this headline is actually saying is that the FDA accepted their new drug application, or NDA, for relutrigine. When a company submits an NDA, it means that they are essentially formally asking the FDA to approve a drug for use in patients. So the FDA accepting that application for review is a big step. It means the application was complete enough to move forward, but the acceptance itself does not mean approval. The application was also granted priority review, which means that the FDA will review it faster than usual because this could offer a significant improvement over existing treatments. So again, they were able to make the case that there is some urgency with the patient populations that could potentially be treated by this drug. So the FDA has set what's called a PDUFA date, that stands for Prescription Drug User Fee Act, which is the deadline for the FDA to either provide feedback on the application or make a decision about whether or not the drug is approved. And in this case, that date is September 27th. So again, super exciting headline. We're making headways with a potential treatment for SCN8A and SCN2A DEE. But it's really important to recognize that this headline does not mean that relutrigine, gosh, that's a mouthful, is approved or commercially available yet. So the drug is not yet approved. It's not yet commercially available. And even if it is approved, there are still a number of steps that will need to happen before it commercially comes to market. So the FDA still needs to complete its review, and approval is not guaranteed at this point. We are in waiting phase, but this is an exciting step forward and something the community will be watching very closely over the next few months. So if we get an update, we will make sure to pass that along to the community. But right now, this is really wait and see phase until September or beyond. And I lost my slides, guys. Okay, so the next thing I wanted to chat about a little bit on the topic of research is the SCNA Research Grants Program. So Hillary and Kacie, along with Jayetta and Gabi from the International SCNA Alliance, initially announced this program at the gathering in Atlanta in December. And this is an exciting new program that 5 global SCNA organizations are participating in together to fund SCNA specific research. We have never done a collaborative grant as a community on this scale before, so this is very exciting. We just kicked it off at the beginning of April, and we're now accepting letters of interest from researchers who are interested in receiving funding for their SCNA-related projects. I wanted to highlight this because this is kind of a milestone for our community of doing this kind of collaborative work. I also want to point out that in addition to seizure-related outcomes, which are typically in our community the easiest to measure when you're doing research or when you're doing a trial, there's also a push for proposals related to non-seizure outcomes as well. So we can only fund what the researchers submit for funding, but we're very hopeful that we'll get a wide variety of innovative new research proposals that we can, as a community globally, put some funds towards. Any questions or comments on any of those things before we continue? I can't see the chat because I'm screen sharing.
There is a question in the chat.
Yep, go ahead, Hillary.
So Jennifer asked if it's possible that at least one of the grants will be designated for the loss of function phenotype.
Yeah, so again, great question. We are definitely encouraging proposals that are related to not just seizure outcomes and that are related to the full spectrum of SCNA. Ultimately, we can only award grants to what is submitted, right? So we've certainly sent this information out to a wide range of researchers. We're doing our best to get the word out within the scientific community. And if a loss of function proposal comes in that our scientific review committee feels is, has scientific merit and could be worth funding, there's a great chance that that proposal could be funded. So we aren't necessarily designating specific grants at this point. This is just the first grant cycle. So it's the first time we're doing this, and there might come a point down the road where specific grants are designated for specific issues within the SCNA space, but this year it's going to be the most scientifically feasible based on who applies. And so we will definitely keep you posted on who receives those grants, what that research looks like. I'm sure we will hear tons of follow-up from the researchers who receive those grants as well. And so, yeah, definitely possible, Jennifer, but I can't necessarily make a guarantee because it really just depends on what kind of proposals we get.
Also, I would just add, Danielle, that Jennifer or anyone else, if you know researchers who are doing that work that you think needs to be elevated or amplified, you should send along the information for applications so
Absolutely.
that they can apply.
Yes. And that is at scn8agrants.org. So, and I'll put that link in the chat. So if you do know of somebody who might be eligible to apply and might have some great, that is completely fair. That's completely fair. I think, one of the challenges, like I mentioned, is that seizures tend to be easier to measure. And so a lot of the research often focuses specifically on epilepsy. I do know some loss of function also have epilepsy. Hillary, do you maybe want to address like why there's kind of that gap there?
Yeah, I mean, I think in some ways, Danielle hit it on the nose. Part of the way that research works and develops over time is based on known population and severity, right? So with SCN8A early days, we kind of knew there was a loss of function phenotype, but people weren't getting diagnosed as regularly because the easiest path to diagnosis um, was through through an epilepsy phenotype, meaning kids with who were presenting with epilepsy were much more likely to get genetically tested and therefore diagnosed. It's the same way that we are seeing more and more mild cases show up because there's broader use of the testing. But you're absolutely right. There is definitely a hole in the research. What happened to the biometric feedback tracking research for loss of function or mixed? I'm not sure. Kacie, do you know about that? Or Danielle? Sorry.
I am wondering if perhaps that was a project that either Dr. Hammer's group or the Alliance was working on. Talked about in LA. Oh, was that Dennis Law's project? Biometric feedback tracking research?
In Michigan? Hmm. I don't know. We can look back over it.
Yeah.
I think it's worth taking a peek. And Jennifer, I think it's really important to recognize again, this organization is the intent here. Although, obviously we're all just doing our best every day. It's a lot to cover, but the intent here is that if there's something that you are seeing that's a gap that you think needs to be filled, you should absolutely be asking these types of questions and passing along anything that you think should be prioritized because that's what we're all here to do. So I think the team can take this one back
Yeah.
and maybe and make sure that whoever it was that presented on it is aware that there is um, a potential for a grant.
Yeah, absolutely. And I do know for certain that there are some researchers in Michigan that are at least aware of this grant. So we can
Okay.
definitely do some personal outreach and go from there and see about following up and where it's been. Yeah.
I think it might also be helpful for this group. And Danielle, tell me, I know we don't have a ton of time left,
Yeah.
but just per the research updates that you gave, looking at, I was just struck by seeing that slide with some basic bench research next to clinical research, and I thought it might be helpful just to give a very, very high level overview for everyone here and who watches it later, what the steps are to from an idea. So the types of things that, might go into the pipeline of like, oh, well, maybe we'll apply for this grant that the SCN8A community is putting forward, all the way to what we hope eventually will be an approved treatment of some variety for the SCN8A community, where it's on the label, right? And it says SCN8A DEE or SCN8A loss of function, or, you know, um, and the process is really long and it is really frustrating, I think, for families to hear something happening in a mouse and they're like, okay, so like next year, will that be in my kid? Um, and unfortunately, it takes a long time, but it takes a long time for fortunate reasons, which is has everything to do with safety. And so if you can think about the drug development pathway as one large process, at one end is that what's called preclinical research, which is bench research, which are these little early studies that people do to say, I have an idea, I have a hypothesis, and I'm going to check it, all the way to I am doing really controlled clinical trial work, not in humans. So clinical, like trials in animals, but at that same level of control that goes to safety. And the amount of work that has to happen between someone having a scientific idea and a treatment being ready for humans is huge and can take decades in some cases. Not always, but it can. And then there's that next step where you see clinical trials in humans, and often they're first in non-patient, like healthy volunteer studies before they get into children or adults in some instances who have the disorder that we're aiming to treat. And then there can be multiple trials that happen even within those patient populations. So FDA tries to be helpful and allow for case by case basis of pushing together those phases. But traditionally, there's a phase one that's healthy volunteers, a phase two that's patients looking for dose, and a phase three that's looking for efficacy. And so that can be also a decade long process. And then on the other side of that is where we are with Praxis, right? So they have finished that what's called a registrational trial, and they're submitting for potential approval, which is beyond exciting and has happened very quickly for this community in an amazing way. And a lot of people have worked very hard at Praxis as well as to support them. And obviously, our greatest hope is that we see approval. But for clarity for this community, an application like that can have upwards of 1 million documents associated with it. And so we're talking about that all being collated and then read at FDA. And that's why it takes a long time. It's not because they're like, oh, geez, we don't want to get to this yet. In the old days, it used to be literally 18-wheelers that went down with the pages. And sometimes there's too many that they can't even transfer them digitally anymore. So they have to go with a CD and fly it down. So, or sets of CDs, I should say. So just to give everybody or maybe it's probably not CDs, I guess it's like drives or whatever, but did some kind of physical thing. But I think it's just really important we talk about all of these steps, but just the vastness of the data that's collected to get there. And it has everything to do with safety and ensuring that, we're doing the right things by our community. So what we're seeing with the Patel Lab, that's really at the first end of that process. And what we're seeing with Praxis is at the other end of that process. And it is really exciting. I get emotional thinking about this. But what's on the other side of that then still is travel, right? There's still hopefully approval, and then there's a commercialization process before someone's going to see a drug in a pharmacy. But we've come a long way, and there's still a long way to go. But I just want to be sure that everyone has a sense of how far between those two things are totally necessary, and we hope to see the next thing, and because then we move the Patel work through that process, and then there'll be another thing and another thing and another thing, and we are not going to stop until there's a cure.
Can I add something to that? I have been in this group. I think I started before you, Hillary, didn't I?
You did. You did.
And when we first joined, there was nothing. When Lily got diagnosed, there was one research paper, and I think that was Dr. Hammer's paper. There was nothing. And I did attend a conference in Boston years ago, and it was talking to different organizations like the Acute Syndrome Foundation, and I had a dinner with many advocates there, and they, at that point in time, and I don't remember how many years in this was, they were shocked at how far our community had come. And this was years and years ago. And I think I told Kacie or Danielle at the last gathering, the gatherings initially were all about what is SCN8A and what does it do. And as time has progressed, the last gathering was all about, we know what SCN8A is, and now this is how we're going to treat it. And this is all the research. And so we went from not knowing anything to now we are actually making headway. And we've done it in really considering how small a community are. We did it in 13 years. And for many communities, that's unheard of. So,
Yeah. And Karen, I think it is like that's the perfect thing to mention right now because it also speaks to, I would often be asked how we did it by communities that were twice our population size.
Yep.
We can't get drug companies interested in us. How are you doing this? Um, and what it really comes down to, and this is why I want to plug for when Danielle and Kacie and Shelly are asking you for information for things and asking you to fill things out. There's a reason that we have been as successful as we have as a community, and it has been all about being able to collect information from all of you and to make sure that companies that are interested in pursuing treatments for our community have the information they need to do it well. Um, and ensuring that we're saying, yeah, we may not be a very big patient population, but we can enroll a clinical trial. Um, I always give the example of our citizen database. We enrolled that citizen database faster. We still hold the record um, I think we enrolled it in like, was it 4 hours, I think?
I missed my opportunity. So I
Yes.
had to wait for the next opening.
Yes.
It was in like very few hours that we did
Yes.
it.
Yeah.
And and that wasn't an accident. I think it often can look like it just happens that way. We were incredibly organized, but we also told all of you why it was important and why it was not just important, but it was urgent. You want urgent results, you act with urgency. And it's also important to trust this team to bring you the right opportunities at the right moments, because also you could be flooded with requests. So I think that those are key takeaways. And I know we're at time, and I'm sorry, I probably talked more than you wanted me to, Danielle, but
No, that was actually really, really great, Hillary. Thank you.
okay.
I think that was very, very important context for sure. Yeah. Well, on that note, I think I think we are gonna call it because we're right at time. As Hillary said, like, and I kind of alluded to earlier, our team is here for you. If you have a question, if there's something you feel isn't being addressed, if there's a programming hole that would allow us to support you better, we're happy to do that. So, or do our best to figure out how we can do that. If it's not a resource that we can provide or a question we can answer, we can point you in the right direction to get that information or the support you need. So I'm Danielle at thecutesyndrome.com. You can email me at any time. You can send me a message on Facebook. I'm here. Kacie and Shelly are always here. I know all of you meet Shelly when you onboard. She's onboarded over 650 patients, guys, which is incredible. So
Wow.
yeah, we are here for you. This foundation, 5 families, 4 families, we're here for you. So with that being said, thank you so much for joining us for our town hall. I think this was a really wonderful meeting, and I'm so glad we all had the opportunity to share and discuss and get some questions answered. And I do want to, before we get off, thank our sponsors, Neurocrine Biosciences and Praxis Precision Medicines, for being the platinum sponsors of our 2026 Meaningful Change series. We do have some really exciting topics in the works for our next couple of sessions, and we will share dates, times, and information as soon as it's available. Thank you all. We really appreciate you being here.
Thanks, everyone.
Bye.
Bye.